Oh, there it is, Fonda. Do you mind if I take a picture real quick? Cause I wanna make sure I get all the testing. Photo. No, not of me. Your good son's not being good. Really? It's not true. Some people are amazing with photogenic.
My daughter is, not me.
Okay, so for our last go here. Who is next? Everybody? Hey, Sue, your patient's on heparin drip. Suddenly, you notice that they're bleeding from the IV side. So good. And they're, they have a Foley bag, and you look, next thing I look at is the Foley, and I go, oh, that looks a little pink, right? So what's happening? Yeah, they're bleeding. Probably because of thrombocytopenia. Secondary to what? Heparin issues, exactly. And what are those heparin issues called? What's it called? When heparin causes thrombocytopenia. Heparin induced, so it's HIT. H-I-T. Heparin induced thrombocytopenia. That's not good. So that means we have to take them off of that heparin, don't we? Are you gonna call the doc? Oh, yeah. Because you have to get an order for what? What is it called? Fondaparinux, which is a treat drug. Very, very good. That's gonna be the premise to the question, is because I really want you guys to realize there is a drug that can be given if they cannot tolerate heparin, and that's it right there. Given subcutaneously. It's very similar to enoxaparin. Now, you may ask the question, do you expel the bubble? I don't know. Somebody look that up for me, because I never thought of it. We actually gave this over, I had a group at UNM, and we gave Fondaparinux, but I honestly cannot remember if we expelled the bubble or not. So teach us, once you guys find out. Okay, next, we have.
It says it's safe to give the injection with the bubble, do not expel it.
Oh, same, so it's the same. Oh, that's nice. So you don't have to memorize for two things. You don't have to, so for enoxaparin and for a treat strep, yeah, or Fondaparinux, very good. So yeah, so they also, want you to be the bubble, right? Treats, yeah. And that's the training. Yeah, Fondaparinux. Actually, when I look at that, what I want to say is Fondaparinux. Like French, but I don't know, it's not, I know it does, right? Everything ends in UX or EAUX, like Papa Dough. Are those restaurants like that, like Nick and Jimmy's, are those all like actually authentically either French or, they're owned by a bunch of Greek guys, Nick and Jimmy. Did y'all know that? They have restaurants all over the place. Huh? And they closed.
Well, they were giving hospital workers.
They closed, and that breaks my heart. Anyway, what I'm trying to say is, yeah, French, but they did their homework and they did it good, because Papa Do's is so authentic, unbelievably. If you've ever been down south, you'll know what I'm talking about. Okay, so I think we were talking about this thing before. Your patient, I've already started working on your test here. Your patient has end-stage liver, you're up on the medical unit, or maybe even critical care, you could be up there. You know what happens? So now, you notice their H&H this morning is like, oh my God, it's like 23. Let's do a good low number here. They're 23 on the hematocrit and 7.2 on their hemoglobin. You go into the room and you have all this bright red blood on the sheets. Actually, it's sort of bright red, it's either bright red, it's in between, it's bloody. You have blood, and you go, what happened? He goes, I just threw up. He's with it though. And you know his history. Is there a drug, are we making sort of assumptions? And of course the doc knows that he probably has a history, undiagnosed, of what? What are we treating here?
That's gonna be.
Because I think she brought it up before.
That's when we're gonna give them the staff.
Exactly, and just landed on you, how perfect. So, the octreotide, now, is the doctor going to make the assumption, at least initial assumption, that it is gonna be bleeding esophageal varices, as evident by that horrible emesis, hematic emesis, the blood pressure's tanking, right? How, so he or she's probably gonna order the octreotide, but how do you diagnose that? How do you diagnose bleeding esophageal varices?
I can't say it.
And just
The
go.
PHARM.
No, that's a treatment, good memory though. Yeah, they have the camera, they have to do an endoscope. And they really don't, they do wanna go far into the stomach, cause those varices can also involve the epithelial of the stomach. Those are the worst ones, cause they're bigger, juicier varices, cause they grow like hemorrhoids in the stomach. They're really gross.
That's scary.
Yeah, it is very scary, because you can bleed out like varices. So anyway, they're probably gonna send them emergently for a scope to visualize. Now legally, but did they probably start the octreotide before? Can you have a GI bleed because of gastritis? Because of alcohol? But if it's copious, it's usually bleeding esophageal varices. We take the blood pressure, we look at the history, and then, yeah, good octreotide for bleeding esophageal varices. Are you gonna be giving that patient some blood? Oh yeah. And maybe even a bolus for that hypertension. And that's usually the way it goes. We, as nurses, substitute measures like the 0.9% saline, we'll get the blood going, the time to screen, but they'll probably have you start that octreotide. Because once you stop that octreotide, you're really preventing them from going into what? They're hemorrhaging, right? Shock, yeah, hypovolemic shock specifically, yeah, good. Oh, by the way, next week is we're starting our shock lecture. Unbelievable, it's already week 10 this week. I don't even know what happened. Okay, Erin, I do have a question for you. This is fentanyl, what is fentanyl?
It is used for seizures.
It is, it is a vesicant, big time, bless you, bless you, bless you. And is there another weird side effect?
The
Gingival hyperplasia. Gosh, did I watch a video on that last night? It was something, I don't know what I'm looking at, but yeah, so gingival hyperplasia. And really the big risk with that is infections in the gums, yeah. Be careful with any sort of, brushing of the teeth, have to be very, very, very soft tooth brush, very delicate. Okay, next we have Julie. We've got, oh, we've already done this one. What's the drug that causes, tardive dyskinesia?
Oh. It is caused by like metoclopramide.
Perfect, yeah.
That makes the raisin.
Yep, the red one. It's a great prokinetic drug, but long-term. Actually, guess what? Are you kidding me? Are we done with the review? We did go around 3 times today. Yeah, so that's like. So I'm gonna add the SNRI. And what's great about this one, you think about all of your great reward, feel-good neurotransmitters. You know, dopamine, norepinephrine, and serotonin. Do we want to, in depression, do we want to increase those? Yeah, that's the whole point. So we prevent the reuptake of them, their reuptake inhibitor. Because once they get reuptaken, they're no longer usable, the substances or the chemicals, the neurotransmitters. So this in particular is for norepinephrine. So I'm gonna look at my card real quick, since we do have time. Really? How fun is that? Would card be on there? Yes, I do. Carbamazepine. Oh, I wanna see if there's anything special with this one. Just give me a few minutes. But I do want you, so the drug is duloxetine. That sounds like, what's the other one? Fluoxetine, which is an SSRI. But this one, it inhibits the reuptake of two things, norepinephrine and serotonin both. Yeah. Which is really good, really. Can you feasibly get serotonin syndrome with this one?
Yes.
You can, because you have that accessible extra serotonin floating around. So give me just a minute, let me see what color, yeah. The site. Also, the tricyclics have those anticholinergic effects, which really is the part that causes the dysrhythmia, like atropine. Then what do you give atropine for? Symptomatic bradycardia. And some people cannot tolerate anticholinergism. Okay, sorry. I just have too much fun with this. Do we have bupropion or Wellbutrin on the test? Oh, I gotta put my list here to make sure I didn't miss anything. Give me just a second. I'm gonna get the study focused just to make sure I did not miss any other drugs.
Yes. The
Bupropion is on there, that's what I thought, there's the Wellbutrin. So what do we give Wellbutrin for? Yeah, depression, that's right, it's an antidepressant, and also what's another use for it?
Insomnia.
Yeah,
What's the side effects?
smoking cessation is another big one. So the Wellbutrin, yeah, so I think we're gonna do indications on that one. The, smoking cessation and depression are the two indications I have, they're the only indications I have. But, side effects, insomnia. So I may put insomnia on that. Yeah. I'm trying to really get you guys ready.
And suicidal.
Huh?
And they're suicidal.
Yeah, SI, all the antidepressants do that. Have you noticed that in your studies? Yeah. So I'm gonna put that aside.
What was the first thing she
So
said?
that was for, what was that for?
Smoking?
Wellbutrin. You know what, I think I'm going to.
It's 2 L's.
So good. I gave you your test of week 3. And you guys are still surviving.
Barely.
That went fast, didn't it, that first 3 weeks? Oh, yes. Do we also have adrenergic drugs?
Yeah.
Which one?
Oh, that's it. Did I grab it? Where's the study guide? Where did I put it? Oh, here it is, okay.
Okay, what else did we need to know about world vision?
Let's make sure we have everything intact from the study focus, and then of course I've added some more.
Used for
This
depression
is the
and
first
smoking
semester in a
sensations.
while.
And it's the side effects is insomnia.
You guys just stop talking for like a millisecond, that would be great. So, I have not modified my PHARM test for a while. And why is that? I really want to bump up your skills for your sake, that's what I'm trying to do here. So we did Zofran, substance P, serotonin blockers in general, that would be the, Prolong QT. We did probiotics, we did polyethylene glycol. I took out Imitral for the pregnant women. We did the phenytoin, promethazine, we did, pantoprazole. Naloxone, y'all know naloxone. I'm probably gonna, oh no, I'm not gonna take that out of there. I know why, because it's a G, that's right. I'm going, yeah, so it's an anti-nausea, right? What's your mechanism of action with that? Pepper? It's going to be a competitive inhibitor, right? That's what I want you to know there. But it's good for nausea, that's the other take home. We did max citrate, we did, H. pylori, H2 antagonist, the IV push slow, carafate. Did I take out, Pepto-Bismol? Yes. Bisacodyl, I'm gonna take out bisacodyl. What do you use bisacodyl for? Laxative, it's a stick 'em up. You can do a pill or stick 'em up. What's stick 'em up? Or rectal suppository, sorry. It's our language. Somebody walk in, hear the instructor say, yeah, we're gonna give them a stick 'em up. And I'm going, huh? We know.
Is that like, could I have given a suppository?
Yeah,
Is that what it was, that specific kind, or is it different?
there's different types. Yeah, but that's the most common, is it Delphox? Yeah, good question. Yeah, no, good question. What about antiemetic safety? What's one of the big side effects? Yeah, drowsiness, sedation. Metoclopramide, we've done that. The English language is going to pot because I hear people say that all the time. What's proper English? Like, I've done that. What's proper English? I did that, or I have done that. And it's become part of our language, and it sounds, to me, still sounds bad when I hear, oh, I've done that. There's another one that just keeps circulating, and I keep hearing, it's like, y'all are wrong.
I heard a lot like.
That's it. I seen it.
Oh,
I seen it. I have seen it.
Or I saw it.
I saw it.
I say I saw it.
Sleep, right? Midazolam, we talked about that. Lorazepam and diazepam, we have that covered for acute alcoholic withdrawal, spasms, anxiolytics, so beautiful. And then, of course, alprazolam's for anxiety. NMS, SRIs, lithiums. Ooh, we did good on these. We just about have it all covered. Oh, you're right, dantrolene is on here. And what is dantrolene? A muscle relaxer, that's all you need to know. Oh, you know what? Guess what? Am I not gonna have it in this test? You know why? Because I'm gonna put it on your next test for your operative meds. Dantrolene is gonna be given for malignant hyperthermia intraoperatively. I'd rather do it that way because it is a muscle relaxer. And I don't wanna repeat that, so I'm gonna take dantrolene off. Oh yeah, I promised you guys that I'd send you guys a revised list. From Thursday on, I was completely busy, and even over the weekend. So, this time I will, okay, because I think I really need to. I'm just gonna have to figure out when. Okay, gabapentin is gonna be on here too. What's gabapentin for? Yeah, nerve pain and seizures, neuropathy and seizures, correct. Yeah. And plus we review this stuff so much, you should know it. So tetracycline, what side effects? Yeah, the T, the teratogenic. What's the age? 8. Good. Cephalose, what's nitrofurantoin? UTIs, good job. Sulfa drugs have a high propensity to cause allergies, and what's the other one? Psyllins and sulfas are bad. Amoxicillin for strep, ampicillin, and oral contraceptives. What's the problem with those?
Decreases
Yep,
the
that's right,
effect.
extra backup plan. Zosyn is a psyllin, right? Aminoglycosides, we did that, metronidazole, which is flagyl. Quinolone, what's a big side effect with that one? Tendon rupture. Banco is a myosin, right? Plasma, we did that. Cipro, what is the weird side effect with that one? Deep tendon rupture. We did Pradaxa, which is the dabigatran. The immunizations is in the app. Exercises. Oh, TPA, what do we give TPA for? Clot buster. And then we know that the heparin is gonna be on there, the Coumadin bridge. It's all right here. Yeah, that's pretty good. So there's just a little offset. Let's see. What was I gonna look up? Oh, I was gonna look up. Oh, I did look at clozapine, didn't I? With that one, what did we come out with, the clozapine, side effects wise?
Lost sugar.
Oh, yeah, that's a big one. Can I write these up here? Then I'm gonna take it. That's right. So type 2 diabetes. Yep. Weight gain. And a granular, which is very dangerous, by the way. Okay, it's going to be, know what this is, the name, what it is, and this is gonna be on there, right here, right there.
Professor, is that a Z for clozapine?
It is a Z.
Okay.
It is a Z. Yes. Okay, where were we next?
Did we talk about the carbon
We're working on it, okay. Yeah. We know why you're getting quantiparanots, right? Yeah. Oh, the lithium, we decided to do the tox level versus the therapeutic level. This one here, mechanism, it will prevent the reuptake of serotonin and or epinephrine. I think that's what I'll do. And you know, just conceptually, maybe for the CNS to know photosensitivity, very similar to SSRIs. And then we go over to our last one here, which is carbamazepine. So what do we use carbamazepine for? It is. So it's actually a mood stabilizer too. They found that as an additional indication. So mood stabilizer, which shows up on the card, so that's a big thing. Even above and beyond, which is strange, above epilepsy, but no both of those, okay? But again, I need to go back to the side effects, and with this one, a granulocytosis, which really can lead to a plastic anemia. And what is a plastic anemia? Low whites, low reds, and platelets. That's how you do it. Low whites, low reds, and low platelets. That can kill a person, actually. That's why I'm putting that on there. Yeah. My previous test question was, what is carbamazepine and what does it treat? It's an anti-seizure. Okay, that's knowledge level. It's too easy. Try to make it a little bit more challenging. But I'm giving you guidance, right, as we go along. As you notice, I'm putting a lot more side effects on here because the CMS does a lot more and the boards does a lot more side effects. Okay. Let's see. So we got our clozapine covered. We've got our SSRIs covered. Of course, St. John's wort. grapefruit?
No, the St. John wort, I feel like every first question.
It's a green.
Don't take it.
Is that right? It's in red. It's in red.
Semester, yeah.
It's in red.
That one, or the G.
Yes. The what?
The G is the ginkgo.
Oh, yes. This is a very good point.
Yeah.
I think what I'm gonna do when I do my comprehensive farm review is I'm gonna just work off these cards and the list, the ATI list, because I wanna make sure that those correlate. But I'm just gonna go down the thing and just ask y'all questions, what you remember from PHARM1. I think we're gonna do actually a PHARM1 review, because we did this, it's gonna be on the, yeah. Because I probably won't be able to get to all of that, so I'll need to do a PHARM1 review. And what I will probably do again is focus in on side effects. It'll be fun for me to know what you guys know in terms of PHARM1 when we do that. Same thing for MedSearch. We will do the big dangerous concepts plus AH1. We have got to go back to Crohn's and ulcer, you know, the Crohn's stuff. So,
When will be exam 4? When is exam 4?
I don't know, I think it's a week. I think it's 13, something like that. 14. Yeah. Because we're tests in a row at the end, don't we?
Yes.
With 13, 14, 15, we have the practice test, 13, 14, and then we have the first attempt in 15, is that right? And then 16, the last attempt.
Wait, so we have 2 practice tests, and you just said that that'd be 13.
Interaction. I've gotta remember for the afternoon class, because I'm really embellishing this today. Oh, sorry, St. John. And for St. John wort is an antidepressant, OTC. I remember when that came out. I think there's still a pretty good market for that. Still Loxetine, yeah. It has that interaction with Loxetine. It doesn't say, wait. You know what it has here on my card? It says St. John wort, in parentheses, increases the risk of serotonin syndrome. All you need to know, because I have to look into that, is this interaction. Don't think about the, I might put that on there, or not, but, okay, what else? Sorry.
Don't think about it.
I'm sorry. I just wanna make sure, I have it straight. I feel really good about that. Oh yeah, the other, like with the carbamazepine, that one also describes, you know, with agranulocytosis, is the blood dyscrasia. So what is a blood dyscrasia? Yeah, when a blood dyscrasia is just a problem, a hematologic problem or pathology. A dyscrasia could mean anything from here to here. Aplastic anemia to just one thing being in deficit or too much. Yeah.
Different types of like bleeding disorders?
Yeah, it could be a bleeding disorder. So blood dyscrasia is, I think, the blanket term to having blood or hematologic disorders. So you may see that on your CMS as being described as a blood dyscrasia. And then of course, one of them would be the agranulocytosis, which could lead to the aplastic anemia. And really the thing that I'm worried about with the patients is the aplastic anemia. Low white cells, low red cells, and low platelets. Those are the dangers. All right. What time do we get out? 45 or 50? 45, so we have about 7 minutes. Well, why don't we do this? I think we're done Modifying. I'm gonna take one more picture, okay? Did you guys take notes on one page with all these?
Yeah.
You did? Because I'd like to actually make a copy of that and bring it to the afternoon class.
Okay.
And I'll take this again too. It would be super unfair. Roto rings. Okay, so can I get that after class for me? That would be awesome. Okay, let's do some quick ones here. But let's just do by hand, see who's prepared. Alright, what is nitroglycerin?
Say that again?
Yeah.
Nitroglycerin? Somebody knew it earlier. What is it?
UTI.
UTI. And the other name is necromantine. Sulfa drugs have a high propensity to cause what? Allergies. What's the other group of antibiotics? Penicillins or the psyllins, yes. What's the problem with the cephalosporins and psyllins? Yep, cross allergenicity, very good, or cross hypersensitivity. Excellent. Dabigatran, what's that used for? AFib, prevention of blood clots and AFib, chronic. If you have acute atrial fibrillation with or without rapid ventricular response, what will you actually give? Like, what will the paramedics give? Yeah, diltiazem for your antiarrhythmic, and what's your anticoagulant? How about in the ambulance? They'll give 3, what's a great PO? Uses an antipyretic, anti-inflammatory, aspirin, yep, antiplatelet aggregate. That's not gonna be on your test, but it's good to know. Yeah, they'll give you 3, or we will give them 3. When they get to the hospital, they typically will not give any other ones. And then they'll give the diltiazem IV push, and then if that doesn't take the arrhythmia out, they'll hang a drip. That's beside the point. I like to give you as much information as I can. We've talked about plasma. Terry did a really good job with this. It's a volume expander, isn't it? And we give that for shock states, give it for burns, especially when you have that maldistribution of fluid. It's a protein. Sucks the fluid in, stays in the vessel, brings up the blood pressure. It's fabulous. Can you have a reaction to somebody else's plasma? Yeah. So you have to administer it like a blood product, because it actually is a blood product. Let's see, quinolone, we just did the details.
Secondary for plasma too, right?
Yes.
Oh, yes. Yeah, you get it from the blood bank.
Yeah.
Blood in it. You guys just did blood in the lab, didn't you? A couple weeks ago? Did you guys have a blood administration record with that?
A long time ago.
Yeah.
I think it was last one.
Did you do it in level 2? Oh, yeah. Yeah, it needs, those kind of things need to be reviewed at the end, and they will. They'll talk about it during the 3-day live as a senior, and then they won't do the lab stuff again, but. And if you guys have any lab questions, oh my God, ask away. Lab is it's a big thing. What's a colony stimulator? Those are just weird names. Yeah. So the alpha-poetin or epopoetin, you know the poetin is releases erythropoietin. Yeah. And then the Oprah bellow pin. And then the other one is the filgastrin, stimulate white blood cells, mostly neutrophils. So Neupogen, Omega. I think we're good, don't you guys think? I think we're good to go here. I think we have a good solid test. Oh, the B12, I'm not gonna put that on there again. Yeah. What was that for? Anemia, yeah, aplastic anemia. Yeah. Misoprostol, y'all did good with misoprostol. Yeah, I think we're ready. I have a good feeling about this test. If you are not doing well on your test, I think this one you could really, did we do scopolamine patch? Yeah, that may or may not be on there, it's just for nausea. It's an anticholinergic type med, so think about possible systemic anticholinergic effects on people. Yeah, we're done. Y'all did good. A lot better than last week, I'm going to eat. And then tomorrow, we're gonna have a beautiful, med surg review. So please be prepared tomorrow to answer lots of medical surgical stuff, okay? Yeah, get complete sleep is good, right? Have you guys ever been to that facility, Genesis? So my brother's there, he was in TSI about a month ago. He's now, I found out this is gonna be his permanent home. Thumbs up, even though it stinks like a nursing home. Those people were so kind and so nice to him. And all the residents were really cool, except this lady, she didn't like me much. One of the residents, she said, I had all my biker gear on and I walked in and I said, oh, where is this? And I said, oh, I'm so sorry. She said, yeah, you better be sorry.
What? Wow.
She was ready. I'm like, honey, I'm a very nice person.
Don't make me mad.
They do it again. She says, you better be sorry. Wow. Do you guys have any questions for me?
Oh, I want to ask not for the exam, but for the